Hello, I'm Michael Ty, President of Advanced Benefit Center. I'd like to welcome you to our presentation on the Obama State Exchange, covered California. I feel comfortable calling it that, as he said he had warmed up to that moniker during the debates. You may have done business with us for 20 years or just now getting acquainted with us. Our goal today is to acquaint you with what this new world of healthcare reform looks like and to help you determine what, if any, part of this is relevant to you and or your dependents. I've covered the history and larger picture of Obamacare in past seminars and newsletters, so today I'll focus only on the state exchange, covered California, as it pertains to individuals. The law refers to state exchanges, which is more recently being referred to as the marketplace. Ours is branded covered California. I'll use exchange primarily, but know that all these terms are synonymous. Let me first clear up any misunderstanding there might be about how all this impacts employees working full-time. Only employers with over 50 employees must either provide affordable health coverage or pay penalties. Those employers with fewer than 50 employees have no obligation under the law to provide health insurance to employees and would do so only to attract and retain good people. It should be noted that larger employers have been given a grace period until 2015 to either play or pay. This presentation lasts about 20 minutes, so let's get started. So why all the fuss? Why $1 trillion? Why the Supreme Court? Why all this time and debate? Well, laws are usually created to make things right. So what was wrong with health care that we needed Obamacare? I would say the motivation was both compassion and economics that drove it back in 2009 when this unprecedented foray into insurance by the federal government began. I say compassion because there are about 50 million Americans who are without health insurance, whether by choice or the lack of availability due to ill health. Coverage will be guaranteed to everyone without concern about pre-existing conditions. I say economics because too many visits to the emergency room are the result of delayed health care for those who are uninsured, and those bills have gone unpaid. Those of us with insurance ultimately pay for that as part of our health care bill. Finally, there will be premium tax credits or subsidies for those who simply can't afford it. This law intends to reduce from 17% of Americans with no health insurance to about 7%. At this point, there's a great deal of concern whether that can be accomplished or not. The California marketplace has offered comprehensive coverage for decades, unlike other states who are in the news about radical premium increases having to replace outdated policies. While the President has offered a one-year grace period to keep your policy if you like it, California law will continue to mandate everyone get coverage by January 1 of 2014 or have to pay penalties. As you may know, one of the major changes brought about by the new law is coverage for many age-appropriate preventive procedures at 100% without any outlay on your part. In California, both our legislature and free markets have responded to much of this over the last couple decades, putting us light years ahead of much of the country. So as of January 1st, 2014, almost everyone, with very few exceptions, is mandated to have comprehensive health care coverage. Those refusing to get coverage will pay fines that we'll cover later in this presentation. Even if someone elects to pay the fines, they still don't have insurance. No longer will carriers be able to deny coverage for those with pre-existing conditions. Let me take a moment to make it clear that you'll be able to buy your insurance from Anthem, Blue Shield, Health Net, or Kaiser through the state exchange, covered California, or directly from the carrier as you have for decades. The direct market will remain vibrant. When companies offer the same plans in and out of the exchange, the premiums will also be identical. So you've heard a lot about these exchanges. Let's take a look. There are a lot of great features to covered California. They just need to get it to work. As I said, California has invested significant resources to put themselves way ahead of many of the state exchanges and far ahead of the healthcare.gov. While you can't currently enroll due to technical failures, it shouldn't be long before those are cleared up, perhaps even by the time you hear this message. The exchange functions as a purchasing co-op, offering several options for you. Since last year, it's been negotiating with several major health plans, including Anthem, Blue Shield, HealthNet, and Kaiser, as well as some regional plans. A key issue to note is that while not publicized, the Anthem, Blue Shield, and HealthNet HMO provider networks are limited in the exchange. In this area, for example, neither Anthem nor HealthNet has St. Jude, St. Joseph, or Presbyterian Intercommunity contracted in their limited networks. The exchange offers simplified web-based tools for comparison shopping and enrollment. The exchange will also function as a depository for premiums paid by individuals and the federal subsidies or tax credits for those same individuals, both of which would be paid then to the carriers as we currently understand it. The rest of the nation is looking closely at Covered California as the model for their exchanges. Individuals will have an open enrollment period from now until March of 2014, then in the fall of each year following. So let's take a look at Covered California. You'll find a link on our website, ABC Group Health, that will take you directly to the individual health plan shopping tool at Covered California. I must remind you at this point that the individual marketplace is still alive and well in the Golden State. You now simply have another place to go that has the potential advantage of getting premium subsidized. We'll talk more about that later. First, you'll need to provide information about you or your family. Now, this is not who you're going to insure, but whoever's living in your household. In the first scenario, let's take a single person with a very low income, $15,000, and use our zip code at the office. And we'll make this individual 40 years old. As you can see here, it says good news. Because your household income is below the Medi-Cal limit, you may qualify for Medi-Cal. That's the low-income welfare program that's been in existence for decades and will be expanded to include those earning up to 138% of the federal poverty level. That number starts at about $15,000 and increases with each additional family member. Keep in mind that when someone qualifies for Medi-Cal, that will be their only option, precluding any subsidies for traditional health plans. The majority of doctors don't accept Medi-Cal, so this person will have to decide if they're willing to forgo the relationships they've had with any previous medical providers. Let's take a look at another scenario. And we'll have 2 people in the household this time. Ramp up the income of the family considerably. Use the same zip code. For convenience sake, we'll just stick with our age 40. At this point, we need to add an adult. We'll make it another 40-year-old and leave the household at that point. Again, we see it says good news. You may qualify for help with paying for health insurance through Covered California. Let's take a look and see what these options are going to look like. At this point, I'm going to get out of this screen. These percentages that you see here, 20, 30, 40%, have absolutely nothing to do with benefits as you and I know them. I don't even know why they show this screen. It just confuses things. So you'll see that the options include a bronze plan, silver plan, gold, and platinum. You'll have several carriers and plans from which to choose. If you want the lowest premiums and don't mind covering the first several $1,000s when you're hospitalized or have other intense procedures, the bronze plan could be best bet for you. Most people will choose the silver or gold. The platinum plans might not be worth the extra premium. I'm going to scroll down past the bronze plans here and look at the silver plan with Anthem. You can see that the premium here, $514 for the couple. The subsidy or tax credit is $114, leaving them with a net premium of $400. You'll see that if you qualify for subsidies, at the end of this presentation, you'll have a link that will help you determine that. Let's take a look at the details of the plans. And as you can see, you pay a fairly reasonable copayment, after which benefits are paid at 100% for doctor visits and prescriptions. The only time that you'd have any significant outlay would be if you were hospitalized, had surgery, high-end diagnostic testing, where you pay this $2,000 deductible and then 20% of that bill. You'll note that regardless of how much your expenses are during the year, you'll have a maximum of $6,350, including your deductible, your 20%, and your co-payments. If that seems overwhelming, you may want to consider a gold or platinum level plan. Interestingly, the premiums increase as you get older, as do the subsidies, making age irrelevant when the final net premium shows up. So let's take a look at one more scenario before we leave covered California. We're going to make this a family of 4. They're going to need a lot more money with some kids. Use the same zip code, and we've already got our adults at 40, both of them, and we're going to need to add a couple children under 18. Again, we got some good news. We're going to get some help paying these premiums. We'll see what that looks like. Exiting this silly screen. And scrolling down again to the same Anthem plan with premiums of $769 a month, the credit or subsidy of $169, leaving a net premium of $600. So there are too many variables to go into in this presentation. You'll need to do your own shop and compare for your own circumstances. We'll get back to the appropriate slide here. The following slides may require more time for you to review, so simply pause if you wish to spend some more time on them, or use the table of contents at the end of the presentation to help you revert back to the slides that you want. Most of you, we're going to quickly go past the next couple slides here that will show the various types of insurance contracts that are available. I'm going to breeze through these, but please return to them if you'd like to review. Most of you will opt for the lower cost and richer benefits of the HMO, which requires you to choose a primary care physician and use specialists within their network. The PPO or EPO have larger networks than the HMO. At least they have in the past. Only time will tell if that will continue. And they allow you to freely move around to any providers within the network. Both the premiums typically and the cost to obtain health care are higher with these plans. The EPO and the PPO have almost non-existent benefits out of the network. So we strongly recommend that you stay in network when you're accessing health care. So we have a new world of health care plans, and with that come plan designs. Well, there are the state exchange covered California. One of the things I like about it is the ease in comparing plan designs from one company to another. Virtually all plans have been redesigned to simplify comparison, both in the exchange as well as outside the exchange, as we'll see a little later. They've been given metal names and have actuarial equivalents, as you can see. Again, don't confuse the percentages with the actual benefits paid. In other words, even though the gold plan says it has an actuarial equivalent of 80%, it pays 100% after the appropriate copays. With this new world also comes new premium structures in and out of the exchange. There are not any dramatic differences in the current and the future rating structures, but it's important to know how they're changing. Instead of your rates changing dramatically every 5 or 10 years, they will change incrementally each year as you get older. Each person covered will be charged a rate for their individual age. So no longer can we cover a 38-year-old as the primary insured and get their 50-year-old spouse covered at the same age 38 rate. Also, you'll pay for each child separately, up to a maximum of 3. After that, there's no charge. You can still cover your children up to 26, but you'll pay a separate adult rate for those children over 20. So you might want to get them to work and get some group health insurance on their own. Finally, folks in their 60s might have paid 4 times the rate of someone in their 20s in the past. That ratio in the future can be no greater than 3 to 1. Older people are going to be real thrilled with that, and the younger ones maybe not so much. The example you'll see here in this matrix is purely fictional, but it illustrates the difference between how it's been and how it will be. This is a worst-case scenario of a family with 4 children, one of whom is over 20. Of course, a family with 1 child or maybe even 2 will benefit from this new structure. So this is what you've been waiting for all this time, is free insurance, or maybe not. The families with incomes lower than 138% of federal poverty level will be eligible for Medi-Cal. Those with incomes between the 138% and 400% of federal poverty level will be eligible for premium tax credits to reduce their cost for insurance. In the year 2014, everyone will be on the honor system regarding what income is stated for qualifying for subsidies. Be careful, though, because the chickens will come home to roost when filing your income tax returns in 2015. So be conservative, or you could be looking at owing IRS some money. The graph illustrates how much a person would end up paying for the Anthem Silver plan after the exchange subsidies. As you can see, a person pays almost nothing at about $16,000, and that subsidy is going to increase, or I should say the net premium will increase up to $30,000, where the subsidy will go away. On the right-hand side of the graph, the line there illustrates a family, and you can see that the graph pretty much does the same. It illustrates incomes between $59,000 and $94,000. So as income increases, subsidies decrease, and net premiums are going to increase also. But as I mentioned, as age increases, premium increases, and so do subsidies, leaving the net premium the same. The enrollment forms can be intimidating with some financial information disclosed, but they're not complicated. If your answers are simple, it can be as short as 9 pages. If your household is full of people, it can be as many as 37 pages. So it's important to note that there are contingencies to obtaining these credits. If the head of household is eligible for affordable coverage at work and is not enrolled, not only is that person not eligible for subsidies, but neither is his family. Affordable coverage is defined as the employee's contribution for coverage for only themselves if that contribution is less than 9.5% of W-2 income for that employee. For example, if an employee's W-2 income is $30,000 and they're contributing less than $2,850 a year, or 9.5%, for just their coverage, it's deemed affordable and no subsidies would be available. Consequently, virtually no employee with group coverage will be eligible for subsidies. Dependents may still qualify, but not the employee. Additionally, if an employee is not enrolled in a plan that is deemed affordable, neither will the family be eligible for subsidies. So it's critical to make sure the employee is enrolled in any affordable group plan. As I said, once it's determined that a member of the family is eligible for Medi-Cal, they won't receive any subsidies for other plans. A person might choose a non-Medi-Cal option if a child is eligible for Medi-Cal, but their pediatrician doesn't accept Medi-Cal. Right now, you can shop and compare at Covered California. Hopefully soon, perhaps by the time you hear this, individuals will be able to enroll online. Right now, you have to enroll with a paper application, and even then, the data won't be entered until they get the website functioning properly. This will probably cause you to have to complete a paper application and submit it through us. So what's next? You'll be making some choices in the next couple months, asking yourself, does the exchange Covered California offer you something you can't get in the open market? If you use the exchange, we'll use a navigator to help you or an experienced agent that can provide you ongoing advice and service. Whether you choose the exchange or the open market, we'll be there to help you. As I mentioned, you'll find a table of contents at the end of this presentation that will help you review any of the slides and comments that have been presented. Now, click on the Shop and Compare link to look at what Covered California has to offer you. After closing that window, you'll return to the webinar for further instructions. Once you've reviewed your options and have further questions, don't hesitate to contact us. It's been a pleasure helping you navigate this new world of health coverage. We hope we can continue to be of service in the future.